Welcome to Let's Clear the Air, a podcast sponsored by the Allergy, Asthma, and Sinus Center, dedicated to educating listeners about allergies, asthma, and immunology.
Welcome back to Let's Clear the Air, all things allergy, asthma, and immunology. I'm your host, Liz Edwards, and today I am joined by Dr. James Kidd in our Bluebonnet office. And Dr. Kidd, it's great to be with you today.
Nice to be here. Thank you for having me.
I'm so glad we get to sit down and talk with our providers one-on-one. I know you guys are so busy, but I love to find out more about everyone. And I'm just going to dive in. Where were you born and raised?
I was born here, right here in Baton Rouge, Louisiana, and I was raised here and went through grade school and college here in Baton Rouge.
When did you decide you were going into medicine?
I pretty much decided, I think, in the 8th grade that I
Really?
wanted to. Yes, I did. And I started getting serious about school when I was in the 9th grade. And
Okay.
I knew that I had to keep my grades up to get into medical school.
That's true. Was there a favorite subject that you had in school?
Really, believe it or not, I enjoyed the mathematics courses more than anything, and I enjoyed the chemistry and the biology. But nothing skewed too much favorite.
So at what point in your medical school and training did you decide to specialize in allergy?
Well, after I completed medical school, I did an internal medicine residency. And during the internal medicine residency, which is 3 years, I spent some time with an allergist in my 2nd year. And that's when I became very interested in the specialty. Mm-hmm. And so I've been interested in allergy since I was a 2nd year medical resident.
What is it about working with the patients that you enjoy and about treating allergies? I think for a lot of people, it kind of gets to the root cause of what they're really suffering from. But what is the favorite part for you about treating our patients?
One of the reasons I went into allergy is it's an outpatient specialty. I was not interested in hospital work. I used to do hospital work. I did hospital consults, but haven't done that in years now. And so I enjoy the outpatient setting, which is very different than inpatient. One of the more satisfying things about allergy is you can virtually get everyone better if they have allergy and you diagnose it correctly. So I enjoy the different age groups. We see all ages. We see infants and we see older patients, and that keeps it interesting.
I love that you say that you can basically get everyone better. I love that. I'm going to hang on to that and steal it. What does a first office visit look like? Can we describe that for the patients who might be listening who have been maybe on the fence about coming to see an allergist?
The first office visit, like most medical visits, involve a detailed history. And we have the patient outline what symptoms they've had, how long they've had the symptoms, what time of day they bother them, what time of year they bother them. So that's an essential part of allergy evaluation is history. After the history, we get the past medical history, the medication allergies, what medications they're on. I have a preference on a lot of my patients. I have them bring their medicines with them every visit so I can go over them. Then we do a physical examination, vital signs, emphasis on the head, neck, and the chest. And so after we do that, you come up with an assessment of the patient. And I would say at least 80% of the time, you have a good idea then of what they have. And then you can proceed with other types of testing.
Do you see a lot of patients who have tried over-the-counter medications and they are not working anymore?
Yes, that's one of the questions I always ask is, have you gone to the drugstore and picked up any medicines? And because I want to know what works and what doesn't work.
Yeah.
And so that's a good part of the history. And very frequently, they have picked up a regimen that works very well.
Yeah.
And they match it to our findings here.
Well, I hesitate to ask, but what do you do in your free time? Like when you're not at the office, what could we find you doing?
I don't have that much free
I
time.
know. That's why I was like, where?
So I don't get bored. I stay pretty busy with my home life. Visit my grandchildren, have a vacation home.
Oh, that's wonderful. Well, it's so wonderful that we got to sit down with you today and get to know you. It's good to be with you, Dr. Kidd.
Well, I certainly enjoyed it. Thank you for having me.
We hope you've enjoyed this episode of Let's Clear the Air. Please consider following this podcast, and remember, if you want helpful and accurate information about allergies and asthma, our allergy experts are here to clear the air.